It's been proven that a diet that is fairly rich in fiber has some protective effect on the development of colorectal cancer. And the rationale behind that is that by taking adequate fiber, you empty your bowels more frequently, and there's less toxic waste left in your colon for a prolonged period of time. Now, it is believed that some of these toxic materials that are kept in the colon for too long a period have a carcinogenic effect on the lining of the colon. And the theory is that these predispose the lining of the colon to developing cancer. Now, it is important to note that whilst fiber is good, too much fiber is actually not recommended. The reason being, by taking excessive fiber, the stools become too bulky, and in effect, it worsens the constipation. So it is a fact that a lot of people may not be aware of. People think that by taking a lot of fiber is good, as much, the more the better. Ultimately, that is not proven to be true. Now, there are other dietary factors that increase the risk of colorectal cancer. More importantly, it is the consumption of highly processed foods, foods that are high in red meat content, and foods that contain a high percentage of fat, both the unsaturated and saturated fat. So studies have shown that in the developed countries, the percentage of fat content in our meals is as high as 40%, compared to the developing countries where it's as low as 10%. So if you look at the incidence of colorectal cancer comparing between the developed and the developing countries, it is clear that the developing countries have a lower incidence of colorectal cancer. So the studies have correlated that fact, and therefore it's believed that a high-fat diet is actually a high risk for colorectal cancer. So aside from the dietary factors that I have mentioned, other lifestyle modifications that most people can adopt would be to, very importantly, reduce smoking, because I think smoking is the one known carcinogen or factor that predisposes people not only to colorectal cancer but to a host of other cancers. The other one is, of course, alcohol intake. I think if you take alcohol in moderation, that's fine, but excessive alcohol intake has risks associated with colorectal cancer. Now, there are many studies that have tried to determine whether probiotics are protective for colorectal cancer. The truth is, there's no evidence at this moment that probiotics will protect anyone from developing colorectal cancer. What probiotics do is they help to stabilize and regulate the environment within the colon because they compete with the pathogenic or the not so good bacteria for the space. So it helps in preventing overgrowth of bad bacteria, but certainly there's no proof that it reduces the risk of colon cancer.